Okay, so this segment might be a bit more muddled because there's a lot of articles to go through, but basically, testing in the UK is approaching high levels of being shambolic, really. Bosses in charge of coronavirus testing system have apologised after its emerged UK labs were struggling to keep up with demand. So basically, the labs are struggling to process all of the tests. Some people are asked to, and we're running out of tests as well. Some people are being asked to travel hundreds of miles to get tested. UK labs were described as maxed out after a rise in demand. 170,000 tests are being processed a day, up from 100,000 in mid-June, even though, what's that guy? James Cleverly said hundreds of thousands of tests are being done. It's less than 200,000, mate. So you're not. So you're wrong. Baroness Dido Harding said, head of the NHS test and trace England, which really should be called Serco track and trace or whatever, said that she's very sorry for the situation, but also insisted the vast majority of people could still get appointments nearby, which is a myth, depending on where you live. The bookings website is now prioritising high risk areas, including towns and cities with high infection rates. There it is. Officials said they're working hard to rectify a problem and a new lab facility will be opened in the coming weeks. By Friday, no one should be asked to travel more than 75 miles to get a test. Do you know how far 75 miles is? 75 miles is more than the distance from Northampton Town Centre to London City Centre. So you'd have to go through Milton Keynes, maybe Bletchley, depending on how big Bletchley is, Luton, St Albans, on Watford to get, say, if the test is in London City Centre, say maybe down here, that's how far you may have to travel to get a test, which is ridiculous, especially if you have symptoms. And why has this caused the problem? The government said the network of labs used to process tests has capacity to process 250,000 a day at the moment. Currently, around 175,000 tests a day are being processed, which the government has said is more per head of population than many other countries, but maybe some other countries don't need it. I don't know. You'd have to look at specific countries. But the government said it has faced problems caused by demand is not problems because demand is not smooth at weekends. It drops on weekdays, and there can be surges over the past month. It meant a backlog has developed, meaning the time taken of turnaround has increased, and that's where the problem is. The turnaround time is getting really bad. With Matt Hancock, blaming lots of different things. He's blaming people that don't have symptoms getting tests, even though we know coronavirus is you can be asymptomatic and carry it, and that's where you can cause real problems. He also said in most cases people should only get a coronavirus test if they have one of the three symptoms of COVID-19: a cough, fever, or loss of taste or smell. Mr. Hancock told Sky News in the last couple of weeks we've seen demand, including an increase in demand from people who are not eligible for tests, people who don't have symptoms. We've seen an increase of about 25% who are coming forward that don't have symptoms and aren't eligible. Mr. Hancock said, stressed that anyone with coronavirus symptoms must still get a test, but he added he'd heard stories of schools sending a whole year group to get a test, thundering that is not appropriate. But then I suppose what he wants is people in that year group who have symptoms to get tested, but what if a lot of them have been exposed? How do you know which ones have it? The asymptomatic ones are the ones that are really dangerous here, and that's what Matt Hancock isn't talking about, and Matt Hancock's extremely mad because it makes him look like a massive plum idiot once again. But we go on. The coronavirus testing system is falling over. So from 2 days ago, this video will go out on the 15th. People across England have told the BBC they're struggling to access coronavirus tests. Matt Hancock said last week no one would have to travel more than 75 miles for a test. So again, just to stress how far 75 miles is more than the distance between London City Centre and Northampton City Centre. So if we keep going, dozens have now are now reported to be unable to book a swab test at all, and this has led people to apply for tests being directed into centres sometimes hundreds of miles away. What we can see from this is track and trace is dying. Not track and trace, sorry, just testing is struggling massively in this country to the point where, in these certain areas here. So if we look at this, Ben Kentish, I think that's how you pronounce his name, from LBC, saying exclusive, there are currently no tests at all available in any of the top 10 COVID-19 hotspots in England. LBC can reveal no walk-in, drive-through or home tests available for people in Bolton, which is one of the big hotspots in the country, Salford, Bradford, Blackburn, Oldham, Preston, Pendle, Rochdale, Tameside, and all Manchester. And so what we can see from this is that the tests in these certain areas are running out, and that means the virus can spread really quickly because people aren't getting tested, especially asymptomatic people. And so this is great work from Ben Kentish, and this is awful work from the government. And you can see that the minimum they should be having is at least they should be having home tests available. At least home tests available. But I think the main reason why these tests aren't available is because they can't process them. So if we look here, this was in May, that the government had sent 50,000 COVID tests to the US for testing, right? But get this. COVID tests are being sent to Italy and Germany as UK labs are being overwhelmed. I don't know how much it costs, but it's shambolic because it takes so long for these tests to be processed, especially when they're being sent to labs in other countries. So it's going to add an extra probably 2 to 3 days minimum onto a thing. So if it's taking a week to test people, what's the point? Because they're going to infect other people. You need to know very quickly if you have it or not. So that way you can quickly isolate, and that way you can get, or you can get on with your life. It's just shambolic. So this here, the government's coronavirus testing program is dealing with a backlog of 185,000 tests. Or swabs, sorry, with tests being sent to Italy and Germany as local labs are being overwhelmed. Not even a week after the government was forced to apologise for continuing delays to COVID testing, the Department of Health and Social Care insisted on Sunday that capacity of the Serco test and trace system, because that's what it should be called, was the highest it had ever been, but there was significant demand for tests. And so what we can see from this, it doesn't matter if the demand, if the supply is hard, if it's not meeting the demand, it's not good enough. This includes demands for people who do not have symptoms and are not otherwise eligible, according to DHSC, Department of Health and Social Care. Leaked documents revealed that the 185,000 backlog and the fact that these tests are being sent to German and Italian laboratories for processing, according to the Sunday Times. The documents also show there have been a big increase in tests being voided. And so what do you tell someone if they've been tested? What do you tell them if their test has been voided? You have to get tested again. You have to wait another 4 or 5 days for your test to come back. It's ridiculous. On Saturday, exacerbated parents in England complained of a track and trace system still in shambles, with some struggling to secure testing slots for children who have developed symptoms since returning to school. And schools are going to be a massive hotbed for coronavirus. And if you can't get your kid tested and your kid suddenly says, oh, I can't taste anything, or I can't smell anything, or has got a cough, especially with flu season, you're going to be concerned. You're going to want to get your kid tested, because your kid can infect you. It's much more, I think it's rarer for a child to infect an adult, but it can still happen. Although the head of NHS Track and Trace has apologised, Serco Track and Trace, who have either been unable to secure coronavirus tests or been told to go through drive-through centres hundreds of miles away. Many people are trying to get a test this week were met with an error message telling them to try again and warning them not to call helplines. you know it's bad when people are told not to call helplines. But yeah, what we can see from this is, they got the article I used earlier. In May, it emerged that 50,000 coronavirus test samples were sent to the US after operational issues. What you can see from this is the government still have no idea what they're doing, and they're struggling here to deal with all of the demand. And Matt Hancock, guy saying, if you need a test, you can get a test, but now he's mad that people are getting tests. It's just shambolic at the moment, and the backlog is immense. And I don't know what more to say about this. Honestly, if I were the government, I would increase sick pay, and I would really start looking at getting more drive-through tests, or prioritizing home kits. They're the two I'd look at. Start prioritizing. I think the home kits would be a lot better as long as you can process them. But the processing has been a big problem. So yeah, I'm going to leave it there. Let me know what you guys think in the comments below. Like, comment, share, subscribe, and hopefully I'll see you in the next one.